Thank you very, very much, Chief, for joining us today.
No problem. My pleasure.
How has COVID-19 affected the Dufferin Paramedic Services?
Well, like everyone, it's been quite an impact. There's no question about it. It has changed the way that we're doing our business, and it's taken all of us to find our way and find our new norm. And together, we definitely have been working really hard. I'm fortunate to have just an amazing team here in Dufferin County, both with the paramedics and healthcare workers all together. And certainly, it has made some big changes. And from a public point of view, 911 calls, I think when they call 911, they're going to see some differences with how the communicators ask them questions regarding COVID-19. So there's going to be a screening process. There's going to be a screening process again when the paramedics arrive. They're going to ask those questions again. So there's definitely different things that they'll see differently. They'll also see the paramedics wearing a lot of personal protective equipment, PPE. They're going to be wearing a mask. They're going to be wearing eye protection, goggles or a shield. They're going to be wearing a gown and gloves. And it might take a little bit longer because when they arrive at your house, certainly, we're used to moving in fairly quickly, grabbing our equipment and moving in, but it is taking a little bit more time to make sure that the paramedics are safe and that they're practicing good practices for them to ensure the safety of both the patient, the family, and themselves. So, yeah, it's changing.
And I think that's of the utmost importance as well, realizing that these changes are made to make everyone safe, but it's really important for all of the frontline workers to be safe and healthy for them and for their families. I mean, it's vital.
Absolutely. I think that's one of the things that we all can identify with is we all are real people and we all have families and we have certain family members that are more vulnerable to COVID-19 and we all worry about our personal health. We worry about our family's health. We really worry about the health of our patients and their families. So yes, together, we have to work to really work diligently to ensure that we do and keep everyone safe.
So has there been an increase or a decrease possibly in the calls that you've been receiving?
Well, we have actually seen a decrease. And so we had a fairly significant decrease, particularly when COVID-19 started. We definitely felt that both at the emergency department and for paramedic 911 calls, we saw a drastic drop in our calls. And primarily, we think that's just that people were afraid to go to the hospital. They were afraid to go out of their houses. So, which is concerning too, because we want to make sure that the public feels safe enough that they can call 911, that we will be able to look after them appropriately and keep them safe and look after their other medical conditions. We have a whole team just working on making sure that safe practices are in place. We have a physicians group watching what the practices are and making changes to make sure that people are safe. But you're absolutely right. If you're having a heart attack, if you're having some acute medical problems, you should call 911 and make sure we will keep you safe. We will look after you appropriately, and don't be afraid. We'll do our very, very best.
As you always do. And we want to thank everybody, not just the paramedics, but all the employees, everyone who works in the front line. Thank you so much for all you do and for all that you do and for taking such good care of everybody.
Well, we do have an amazing team at Headwaters and Dufferin County Paramedic, and I couldn't be prouder than our community, to be honest. We have just a truly amazing community of both medical providers, front-line medical staff, and just generally the community itself.
Absolutely. Are you in need of PPE equipment or the personal protective equipment? Is it something that people can donate? Is that something that you require?
Well, the PPE is, if you watch the 6 o'clock news every night, you know that there are pressures on personal protective equipment, in particular N95 masks, gowns. So there is certain things that are really sought after, and we're using a lot of it, and much higher than we normally would. But we really got to do a big shout out to our logistical team. We have a provincial team that we're able to acquire PPE from. We have local. I want to say how great the local response, and that's some of the comments. I don't want to talk about our community. They are just amazing. We've had so many things donated. Local businesses and local citizens have just been amazing as far as getting us our PPE. So that's been something that I guess as a frontline healthcare worker, everyone really, really appreciates when they see the community support that we have received.
Absolutely. And let's talk about some of the local businesses and what they've been doing as well.
Oh, well, there's just so many things. Well, first of all, with the local businesses, one of the things I want to say is how quickly they've adapted to meet the community needs and make sure that they're dealing with safe practices. And I know that they're watching the public health recommendations, and we're really lucky to have the Guelph Wellington Dufferin Health Unit here giving us good advice under the leadership of Dr. Mercer. We have seen our businesses, first of all, donating, supporting, not only just front health cohorts, but just the community and in a whole. Like, we've seen them make changes in order to service us better and under these very difficult times. And certainly, I just want to say how great they've been and applaud them for all their work to support us as we make this change and find the new norm.
Absolutely. And I think there is going to be a new norm, even when we get to the other side of this. I think people have adapted, people have found silver linings in different ways of doing business and healthcare and how things are done and the procedures that are done. So I think we'll definitely have a new norm once this is all, when we get to the other side as well.
I think so too. I do. So
the job of a paramedic is inherently stressful, and they're always under a lot of stress. And what are the paramedics and staff doing to stay positive at this time?
Well, we are a pretty positive group. First of all, I have to say that. They've got just a great attitude on a day-to-day basis, but there's no question that COVID-19 causes stress. And as we talked about earlier, that, they worry, but like I say, they're a really close-knit group, and we joke a lot, and we're really struggling with the social distancing because we do chat a lot, we talk a lot, we make a lot of fun, and so that's that obviously now we have to wear a mask in the station as well and in the vehicles to protect paramedics from one another, but working through it. We're chatting with one another. We're talking about things. We're still laughing when we can. And we do have things like an EAP, which is an employee assistance program. We do have the community mental health as a hotline. I think one of the biggest things that we've done, though, is we first of all recognize that, people are under stress and it's a difficult time. And, trying to say not only to paramedics, kind and be thinking about people being under stress and how they may react. And our peer support team, I really want to say how great they are. When we have a difficult call, we have a group of individuals that have been trained in peer support, and they'll reach out to that paramedic to make sure that they're doing okay. And if they're struggling, certainly then they can take a look at the resources we have available for them and make recommendations and just generally support them.
Yeah, and I think at this time, people, when they're not feeling well, they're completely, their stress level just goes up that little bit more, and their reactions may not be what they would have been, 2 months ago or something like that. So I think that having these types of supports in place for both the patients and for staff, I think are phenomenal.
Yeah, I can't agree more. And I've seen the province have done a lot just with our community as well, trying to set up hotlines and support systems, for that, because I know that everyone's feeling the stress. There's no question.
Absolutely. And I'm assuming that when this all started, this began somewhat in January, when it became kind of very prevalent in the news, that you made precautions and you start working right away for those types of things. And I believe, correct me if I'm wrong, that you haven't had any COVID-19 cases with the staff. at this
Yeah,
point?
we've been very, very fortunate. The Dufferin County Paramedic Service, we've had have had paramedics exposed, and we've had them self-isolate, but we have not had to date, and touch wood, that will continue. But we've been working extremely hard and to make sure to keep our paramedics safe with our good PPE and education as far as techniques and the best way of hand washing, distancing, all the different things. And it's something that's changing every day. But we have been very fortunate that none of our paramedics have been exposed. And so we've been able to staff 100%. We've had our response times are as fast as they ever have been. And so we have resources available.
And I think that's important as a community as well, that we make the realization that all of these precautions that have been put in place by municipal, federal, and provincial governments are there to make all of us safe. And the safer we are as a community and the steps that we take make it even more safe for the frontline workers that have to and deal with the general public on a daily basis, for sure.
Yeah, and I think that's right. And when I think of, what can the community do for us? Those are the things that we really would like to see, is that, pay attention to the public health notifications, maybe go on the website and check out what the latest recommendations are. Because as we've gone through this process, we've learned a lot of things, and things have changed from the first day that we started with COVID till now. And I can only say almost every day we've made some kind of tweak or change, and same with public health. But the one things that do remain the same is, the things that we can do every day is wash our hands, make sure that we limit our touching our face. When we're out in the public, again, the hand washing, social distancing, and those are the important things to stay safe, and making sure that we do everything we can within our power to support our community, and even things like, checking on your neighbor or checking on elderly people, give them a phone call. How are you making out? And I know Teena, you were mentioning about looking after your parents and supporting them. Like that's the things that we do. And truthfully, I've never been prouder to be a Canadian. I see how we've responded. It's been awesome. I haven't ever been prouder to be right from here from Dufferin County. Like, things are working. People are supporting one another, and we will get through. We will get through, and we'll be stronger on the other side.
Absolutely. And I think the important thing is especially when the nicer weather's coming, is not to become complacent and still follow those rules, so that when we get to the other side, we have as less loss as possible, and moving forward, we'll be stronger for it. You're absolutely right. I want to thank you so much, Chief, for joining us today and sharing what's happening with the Dufferin Paramedic Services, Dufferin County Paramedic Services. And we wish everyone there all the safety and health, and we thank you very much.
Teena, I just want to say thank you very much for reaching out to us. I just, on behalf of the entire Dufferin County Paramedic, I just want to say thank you to everyone for all your support. I want to make sure that we thank our Hills of Headwaters Ontario Health Team and all of our partners. They have done just an amazing job with the leadership and the support of each and every person in this community. And you are doing an amazing thing by giving us an opportunity to talk about all the great things that are happening here in the Hills of Headwaters.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
I'm Marianne Kennedy. And I'm Dawn Rockall. And we can't wait for you to join us on some of our new adventures on Season 2 of Ghosts of Dufferin County and Beyond, right here on Rogers TV.
Welcome to this COVID-19 local update for Rogers. My name is Teena Avery. Joining me today, we have Christine Sevigny, Executive Director of Caledon Meals on Wheels. Christine, thank you so much for joining us today.
Thanks for having me.
So let's talk about the services that Meals on Wheels provided pre-COVID-19, just to give everybody a refresher and an update of what you were doing before all of this started.
So our basket of services included our traditional hot meal program, which was available in Caledon and in Orangeville and the surrounding areas, frozen in Caledon. And then we had some seniors groups that were happening both in Caledon and Orangeville, as well as friendly visiting that was happening in Caledon. So that's what we were doing prior to the pandemic.
And how has COVID-19 affected how you're operating now?
Well, we've been kind of looking at what the needs are in the community and trying to figure out how we can ramp up our services. Obviously, our groups of seniors groups had to close for safety reasons, but we've actually expanded our hot meal program, so it's available. We're able to take on more people who need the prepared food as well as our frozen, and we've expanded to a grocery program. So now we call it our We Care grocery program. So it's actually a small basket. It has a $30 value of groceries, and people pay $30. And if you can't afford to pay, then we also have subsidies available through donations. And it has just the essentials: bread, milk, juice, fruits, vegetables, and some other items. It has a minimum of $30 value, and it's delivered right to your door. And our practices for delivering both the hot meals and the groceries is kind of a modified drop, so that we don't come into contact with the seniors who are coming to the door.
That's wonderful. And I love the We Care grocery program. I think it's vitally important now to make sure that everybody has sufficient food in this stressful time, for sure. So has there been an increase of people needing your services?
Yeah, we've seen a steady increase. When the pandemic kind of first hit the news, and seniors and people with disabilities or underlying health conditions were told, like, please don't go out, we saw a real spike in our frozen meal program. I guess people stocking up, trying to kind of prepare for staying indoors, and we've had a steady increase over time of people who are in need of kind of just food items that are prepared and easy to keep at home. So it continues to grow as this pandemic continues.
So with that, do you have a growing need for volunteers for deliveries, or are you all set and in place?
When we started, we obviously had a few folks who had underlying health conditions who kind of stepped back right away and said, for my own health reasons, we can't do this. And then when the chief medical officer of health originally said, anybody over 70 years old should not be in contact, we strongly encouraged our senior volunteers to step back for their own health. And so, at first we were a little worried, but we've had an overwhelming response of community volunteers who are willing to help us. So we've actually been okay. So we've had, just as many people call us and offer to help as we've had people step back. So, and our friendly visiting program too is still going, but it's not in person. So we've had some volunteers beginning to call our in-person volunteer clients, or people who are just kind of lonely from being isolated for so long. So there's those opportunities as well.
And I think that's vitally important, especially for anybody, not just seniors, but reaching out and contacting people that are alone, because we're going into week 8, and for people who are all by themselves, I think that need, that connection with people is very important. So they're doing that via things like what we're doing now, like Zoom calls.
Yeah, mostly phone. We don't really. If the person has the capability of doing it and they can arrange it with the volunteer to do it by Zoom or another modality, but primarily it's mostly by phone.
Okay.
Yeah.
So if someone's in need of your services, how do they go about it? How does it start? Walk us through the process as it is right now today.
Yeah, you know what? They just have to reach out by whichever way they're most comfortable with. You can call us on our phone line. You can reach us through our website. There's a form that you fill out on the website, and it kicks it over in the form of an email to us. You can send us an email. And we just set you up, and hopefully within a day we can get you started on the prepared foods, either the hot or the frozen. And for the groceries, it's usually a couple days advance notice that we can get kind of groceries out to you if you need it. For friendly visiting, it'd probably take a couple days to get a good match for you. But we really do appreciate the opportunity to come and tell people that these services are available, because we know there's lots of folks out there, especially in the rural areas, who maybe aren't connected already to seniors groups or other organizations, and we want to make sure we reach them.
That's phenomenal. So how else can the community help you?
You know, we've been so blessed. Like, I have to say, we put out a call for hand sanitizer for our volunteers when they're doing deliveries, and within a week we had all the hand sanitizer we needed. People have been donating to help us with the increased costs of the services, because we've had to, you know, all of our meals are subsidized anyway. The clients never pay the full cost of the meals. So with the increase, those donations have been extremely helpful in helping to cover off the costs. So yeah, I mean, just keep us in your, in your thoughts. And you know what, I think most importantly is identify people in the community, your neighbors, your friends, the person that lives down the street on the farm, to say, like, you know what, maybe I need to kind of reach out to them to see if they need anything, and then just, make a referral to us. And if we can't, for whatever reason, it's out of our area, we have partners like Dufferin County Community Services who help, and we've got connections to other resources and Meals on Wheels in the community. Our door is open, and even if we don't provide the service, we're happy to find somebody who does to help.
Wonderful. And that was actually going into my next question with regards to with the increase in calls that you've received. Have you been seeing younger people reaching out to you as well? Because I know primarily your demographic is an older seniors. So has there been an increase in the number of calls from maybe people that wouldn't necessarily call Meals on Wheels?
Yeah, for sure. We've had people with disabilities have always been our client population as well. So we've had those, and that includes people with mental health issues. We've had some folks who maybe have some anxiety around going into the grocery store, so we've been able to help them. We've had people recovering from surgeries or an illness, someone who's had hip surgery, or that just traveling makes it too hard to get out or even to prepare food. And those people come in all ages. So we continue to, help them. And we've actually had a call from some young moms who are quite ill during their pregnancy and just need some prepared food. So yeah, we try to, as long as they fit that criteria, senior, people with a disability, or someone with an illness or recovering from surgery, we can help them.
Absolutely. That's phenomenal. And then anybody else who's looking for help, there are other programs all throughout the county for sure. We want to make sure that everybody is being fed and is healthy. So of course there's the Dufferin Food Share, which is run through the Orangeville Food Bank, and all the neighboring food banks and churches and all the different programs as well. So if you're looking for that type of information, please look them up as well. So what are you doing, Christine, to stay sane in this crazy time?
Oh, that's a good question. You know what? I find, I've been one of the folks in our office who are working exclusively from home. And that's just, again, to reduce the capacity in the office so that our frontline people can do what they need to do. And, I have to say it's a bit lonely being at home and working from home day after day. But, being able to connect with my colleagues and with other folks over Zoom or over the phone has been extremely kept me kind of sane and happy. And I think it's about a balance, trying to see the bright side of things. I mean, as horrible and as challenging this has been over the past, like you said, 8 weeks or so, there's been a lot of silver linings, and you see how the community has come together, and you see the wonderful partnerships and how people are working together to help the community. It really is actually very uplifting. So that's always been kind of something I look towards.
Absolutely. So if people want information about the program, where's the best place to go?
So call us. If you're out of the Caledon area, it would be long distance, but it's still 1-905-857-7651. or you can reach us at info@cmow.org. Or you can just go on our website, you click through a few screens, and you'll find a place where you can fill in the little form, and that is www.cmow.org.
Wonderful. If are the volunteers in need of supplies as well? Like I know you said that you have an ample supply of hand sanitizer. Is there like maybe somebody who may not be able to make a financial donation, but may be able to donate some gloves or anything to assist in the delivery program?
You know what? We actually are covered right now. We're very grateful that we have what we need. However, if you do have those supplies, we are connected to our Hills of Headwaters Ontario Health Team. So and there's tons of organizations and healthcare organizations who are still in need of personal protective equipment. So if you want a quick number, just give us a call, and we'll hook you up with another healthcare organization who definitely needs those supplies.
Wonderful. So how long have you been working with Caledon Meals on Wheels?
Oh, I've been there now almost 8 years. And this for sure is a unique situation. But yeah, it's been interesting, and I'm glad we've been able to kind of meet the challenge.
Wonderful. So how many people are working with Caledon Meals on Wheels, including volunteers?
We have, most of our, almost all of our staff are part-time, and they do all sorts of things in terms of managing volunteers and friendly visiting and the groups and the meal programs and the groceries. So we have about 14 bodies or people, but they're actually all part-time. And we have over the course of the year, if you include our special event volunteers, over 250 volunteers, with about 100 of them being core meals volunteers. So they're the ones who are out in the community and are the face of our service, and are the ones who bring smiles to the people at the door.
Just one quick question before we go, with regards to if somebody's interested in maybe not delivering the meals, maybe they want to remain in their home, because there's a lot of anxiety and a lot of people do want to do that. But if they want to be somebody who reaches out and calls, and how does that procedure work, and how do you match up a volunteer with one of the patrons that needs your services?
So we connect with the potential volunteer, and we would do a police check, obviously, and do an interview and find out kind of interests and hobbies and kind of what they're looking for to get out of the volunteer experience. And then we look at the people who've requested volunteer visitors, or now they're phone volunteer visitors, but in the future back to home visitors. And they can, and then we make a match, and we set up a first time meeting, and the meeting then we'll see if there's a good match, and then it's usually history after that, and wonderful friendships are formed.
Absolutely wonderful. Christine, I want to thank you so much for joining us today. And by all means, if you need any updates, you'll come back and visit us again.
Thank you.
So all of you out there, please stay safe. Please remember to be conscious of the rules that we should be following, keeping the physical distancing, washing your hands, doing everything you can to keep our communities safe, as these wonderful people at Caledon Meals on Wheels are doing as well. Stay safe and stay healthy, and we'll see you soon. Tish, thank you so much for joining me today.
Thanks for having us, Teena.
So let's talk about the services that you provide or provided before COVID-19 and how that works.
Well, we have a couple of programs here at the shelter that we run regularly. We, of course, offer intake for pets that people can't keep any longer for various reasons. We also, of course, then offer adoptions of pet cats, kittens to homes. We do take in strays as space permits as well. Cats that are wandering the streets and no owners can be located. And lastly, we offer a TNR program, and that stands for Trap, Neuter, Return. And that's where we look after feral cats that live outside, or as they're known now, community cats. So we do a spay-neuter program for them and take in any kittens from the colonies, because the young kittens are still very tameable at that age.
Okay, wonderful. So how has COVID-19 affected your business and how it operates?
In a couple of ways. Basically, the first thing and the biggest thing right now is that we're not able to offer our TNR services at all. Because the vets are also working on limited services, they're only allowed to offer emergent services at the moment. And spays and neuters, unfortunately, are an elective surgery. So they have to pare down on that. So at this point in the season, we would normally be in the colonies, and those are in barns, factories, behind factories, et cetera, that kind of thing. And even in people's neighborhoods underneath their decks. We would usually be out live trapping feral cats to have them spayed and neutered and then returned to their community so they stop reproducing. When we're there, of course, we'd also be taking in kittens that we find, and we're not doing that because we're not out in the colonies trapping. So we're missing out on a lot of kittens that are out there. I mean, we'll get them eventually, but they'll be older and harder to socialize.
Are you still offering your adoption services right now for the cats that you do have?
We are, thankfully, yes. We just pared down the adoption process, of course, much like many other businesses. We can't do curbside pickup for visits, but we are making sure that, we only have one person in the building at a time. The volunteers are usually in the shelter in the morning doing the feeding and cleaning, and they each have their own room, so they're able to social distance quite easily and safely. And then we're doing adoptions in the afternoon when none of the volunteers are around. It will be by a scheduled appointment, and the people will previously have already chatted with me back and forth about which cat might be suitable, also about making sure that they're a suitable home and be pre-approved so that on the day that they come to visit for the adoption, if that cat is appealing to them and we feel that it's a good fit, the cat can then go home with them right away rather than having to schedule another appointment for a pickup, which is what we normally would have done.
Right. So how many cats do you normally have in the shelter at one time?
It varies, of course, because of kitten season. During the summer, we have a lot more cats numbers because we've got kittens in, but generally we will range anywhere from about 25 to 50 depending on the season. The kittens generally are in foster homes for most of the time, and then they come back to the shelter when they're ready for adoption on our meet and greet days to be seen by the public.
So let's talk about the fostering program. How does that work when you have kittens? And are you still looking for new people to foster, or at this point you're just working with the people that you currently have? How does it work?
At this point, because of COVID-19, we're just working with the foster homes that we have because we're familiar. They have all the supplies. There doesn't have to be a big change of information. With the foster program, we've got quite a few families that will open up their homes to kittens. With our kitten program, we only take in kittens out of the feral colonies, off the streets, literally. So they usually need a little bit of TLC when they first come in. Most of them are a little bit nervous, shy, semi-feral, excuse me. So they need to be hand-fed and tamed and really have a lot of TLC. We usually will foster those ones out either on their own or with a friend, depending on how feral they are. The more feral they are, the more work you have to put into them. So that's when we'll usually separate them up into singles. We also, of course, come across mothers who are pregnant or have a litter of kittens. So those foster homes will generally have a separate room where they can keep mothers safe and away from other pets in the home. Whereas the other kittens we're looking, excuse me, the other kittens we're actually looking to socialize them with pets in the home so they get used to children and noises and TVs and dogs barking and that type of thing. So they generally will go out for a couple of weeks, and when they're ready socially for adoption, they come back. And age-wise, of course, for the young ones.
Absolutely. So how many cats do you have right now?
Actually, in the shelter right now, we're doing very well. COVID-19 has had one very positive effect on the shelter, and that has been adoptions. Everybody is home. They're nesting. They're thinking, geez, we've been thinking about getting a cat for months, but we were so busy. We didn't get around to it. we have time now. So they're all on the internet looking at cats at various places. So adoptions have been really, really great. At the moment, I think we probably only have about a dozen cats and 2 litters of kittens, which is pretty amazing for us. And, you know, even some of the harder to adopt cats have been getting looked at because there are less cats around, and some of the bigger shelters were shut down for the whole month of April, whereas we just pared down and did individual appointments.
So if someone is looking to come in and to adopt a cat, what is the procedure? I mean, how should they contact you? What happens?
The first thing they should do is go to our website, catsanonymous.ca, and on the website they will see a tab that says Cats for Adoption. They can then look at all the cats that we have available. The description will be there of what the cat likes, doesn't like, what kind of home it would fit into. There's also some pictures so they can get a feel for, you know, what the cat looks like. Some people are very particular about wanting specific colors, etc., and that's fine. So that's where they would go first. When they see a cat or a couple of cats that appeal to them, they can then go to the adoption information and they can read how the procedure works. There's also an adoption application there that they can fill in online and send to us. That way we can do our processing ahead of time, make sure it's the right fit, make sure they're a good home for the cat, and then at that point we'll email them and schedule an appointment for them to come in and have a visit.
Wonderful. So you are not being funded by the government. You're basically you're a not-for-profit organization that requires donations. So how can the community help you? Do you need financial donations, pet supplies, pet food? How can the community help you?
At this point in time, you know, there's a few things that we've missed out on doing. One of the things we've had to stop as well are our fundraising activities. And being an individual shelter, that's how we survive on our surrender fees, our adoption fees, and donations from the public. Generally, during the month of April, during the month of April, the 2 of the local pet values, Acton and Fergus, run a donation program where they collect food for the shelter, and of course they weren't able to do that this year, so our food supply is a little bit low. The other thing we weren't able to do is have our regular fundraiser, which is our big one, which is our silent auction and luncheon. So that of course had to be canceled because we can't get together in a group of 100 right now. So that's going to affect us financially as well. We usually raise about $8,000 to $10,000 at that function. Hopefully we'll be able to have it in the late fall. Who knows? We'll just have to see if people are comfortable getting together at that point again or not. So either way, as far as donations are concerned, we need some financial help as well as donations of food.
And do you require any volunteers at this time, or you're all set for how you're running right now?
We will need volunteers in the future, but again, at the moment with social distancing, we wouldn't be able to do the proper training protocol as far as cleaning and disinfection protocols. So we're not reaching out for new volunteers at the moment. We're working with just, sort of half of the volunteers that we have here at the moment.
And how long have you been in operation?
Believe it or not, we have been in operation since, officially, we became a charity in 1999.
Wow, that is phenomenal. And what made you decide to open up a cat shelter?
Yeah, that's a pretty interesting question, isn't it? A lot of the times I think that myself. How did I end up here? Really just basically I started with 2 cats of my own and I adored them. And then I started to work at a local vet clinic and saw how many cats were being brought into the clinic to be euthanized or surrendered for adoption because of various reasons. And I started to take in some of them, and I started to take in some strays in my home. And I thought, well, this is great, but my house is getting kind of full. And from there, we branched out to starting an official shelter. So really, it was kind of the snowball effect.
And your love of cats, ideally.
Clearly, yeah, that started it all, for sure.
Absolutely. So when you're not playing with all the cats and kittens that you have there and your own, what are you doing in your spare time just to stay sane and to deal with the situation that we're in?
Well, Thankfully, the weather's getting a little bit better because I do love to be out in the garden, doing yard work, etc., that type of thing. And other than that, I do pretty much work too much. With help in the shelter, that's great, but there's still a lot of paperwork involved and computer work and emails. So I do spend a lot of time on the computer as well, responding to emails and just researching various things to make the shelter run better.
Just because I'm not sure we did clarify. So if somebody may not be able to donate financially, but may be able to pick up some extra pet food or some supplies or toys or whatever it happens to be, how would they go about getting those to you?
Good question. There are a few ways that they could proceed. Number one, there is a donation bin outside the shelter, and it's clearly marked. So if someone wanted to pick up some extra food at their local pet supply house when they are shopping, they could do so, and then they can just come anytime and leave it in the donation bin. Rest assured, everything is disinfected every day, so it's safe to put it into the bin. The other thing that some people are doing is they're ordering online. And they're having it shipped directly to the shelter. So they can get our shelter address from the internet, from our website, and then they can just have the packages shipped directly to the shelter. The other idea is gift cards. You can always purchase a gift card and pop it in the mail, old school, snail mail, and send us a gift card so that we can use that as well.
That is amazing. So I just have to ask out of curiosity. So when you're fostering all these cute and adorable kittens and cats, how many of them do you end up saying, this is the one that I want to keep for my home?
Yes. They call that foster failing. And it does happen with volunteers who are fostering kittens, especially. Kittens are a lot of fun, and every once in a while there's one that just appeals to you. For myself and my partner, we actually are dedicating our home to seniors. So we have an age limit. You have to be over 14 to get into our home. And usually, we'll choose someone in the shelter as space permits in our home and the dynamics, somebody who is less adoptable due to medical reasons that we're able to deal with, but perhaps the general public wouldn't be able to. Someone who's, maybe on their last year or two.
Wonderful. Well, that's phenomenal. Thank you so much, Tish, for joining us. And thank you for taking the time to tell us all about the shelter.
Thanks for having us and helping to get the word out there. Much appreciated.
My name is Stephanie Lorero. And I'm Ksenia Shpak, and we're the hosts of a new show here at Rogers TV called Socialite. We're here to keep you guys in the loop on all things trending, from social media to the latest tech gadgets and the wonderful world of Hollywood. We got you covered. Catch us every Wednesdays at 4:30 p.m. and Fridays at 6 p.m. only here on Rogers TV.
Are you a woman experiencing abuse? Do you know a woman experiencing abuse? Help is available any time of day or night. ShelterSafe.ca is an online map that helps you find a women's shelter or transition house that meets your needs so you can live a life free from violence. ShelterSafe.ca. Help is just a click away.
So Kent, lacrosse is this is the time of year when you guys are on the floor or on the field playing, and it's disappointing, I guess, for everybody involved in Orangeville minor lacrosse. What are people doing? I guess kids getting together in groups of 2 or 3 and goofing around, or what's happening out there?
Well, I mean, to be honest, I've seen quite a few kids around their homes shooting and with their stick in their hand and things like that, which is always good to see. Right about now, we would just be finishing our tryouts for our rep teams. So we're not too far behind right now. We are still hoping to have some kind of box season.
Right.
We're just waiting on directive from obviously the province and the OLA. So we might be able to fashion some type of season, but we're just going to have to wait and see. This is strange times for sure.
Yeah. What's the typical length of the box season?
Usually we're beginning the first games right around now. And then by the second week in August, we are finishing up our Ontario Championships.
Right. Interesting. So I wonder if by any chance we can get a season started in the summer. That would push hockey out a little bit. But I guess that may be a compromise. That's something that can be worked out, right?
Well, I know that the OLA has shared with us some plans on possibly a different type of looking season. There could be strictly playing tournaments and then playing our provincials, shortened season, things of that kind. There's many scenarios. So far, we've only had to postpone our field that would have been played in the spring, and as of right now, we have plans to play in the late summer after box. And as far as hockey and so on, I'm sure we can work around. Rick and I can coordinate and make sure that everybody has their proper time.
Right. Good. So, Joe, were you planning to coach this year, or were you hanging up the whistle? What's going on?
I will say it was an interesting season. And first of all, I want to thank Rick and the executive with Orangeville Minor Hockey for just being phenomenal in communicating where we were and with the COVID issues. The communication, which of course came from Hockey Canada, and the directives that were eventually passed on to the membership, the coaching staff, all different levels. Again, Rick and the crew there have been just wonderful. I think the biggest disappointment was, in fact, from the players themselves and the parents. For those of us that have coached for a long time, I've coached not only minor hockey, but also soccer and also basketball. And I take a look at some of the organizations we have in the community. I've even, taught tennis, and I see everyone is on somewhat of a holding pattern. And the frustration that exists is really with the young people who have dedicated so much and so much desire. As Kent knows, with lacrosse, we have a passionate lacrosse community, and there's nothing worse than having people sitting on the sidelines. You may have a few that are shooting a puck in their backyard, or passing a ball around, even a football with the Orangeville football team that we have in the minor sports there. I think the biggest frustration is the fact we didn't get a chance to officially complete the season. I was fortunate to be coaching a team this year that was in last place, and then we got into the playoffs, and all of a sudden we found ourselves in first place. And these were young gentlemen that were heading off to university or college, and so many of them were looking at this as their swan song, won't be coming back. And in my decision from coaching, I've always had this passion to coach young people, have enjoyed it tremendously. Where I sit for the fall, it's still up in the air. And, even from the counselor perspective that I'm fortunate to also have, there's been a number of people who've reached out and are asking, is there any way that we can end up getting into the parks and, even just, play around? The Lions open facility we have there on Diane Drive is one of those locations people have been looking at. And of course, unfortunately, we're not allowed to have the general public do what they normally would like to do. So, I really sympathize with Rick and Kent and the other organizers and presidents of the different minor sports organizations in the community. On one hand, you have people who are fully dedicated in making sure the organizations are successful, which they are, and we are really fortunate in our community to have these organizations and the leadership. But at the same time, you have the patrons, the parents, the players who are all anxious and wanting to play. But, again, here we are. Waiting and hopefully getting a lifting and or at least a modification to the pandemic shutdown that we have to all deal with.
Yeah. I guess some good news that we're hearing out, various sources, press sources, is that both the United States and Canada, the relaxation for young people is something that is being talked about now. And that's because this virus has not been affecting young people as much. There's some terrible tragedies with long-term care facilities and the the over 70 crowd has really been affected deeply by this, but it seems to be not affecting young people. So I would expect when Premier Ford steps up to start the relaxation, that one of the first things that would happen is that games involving young people could start to happen again. I would hope that that's the case, but I don't know. Has anybody got any dirt that they know of background they've heard from their associations, like Rick or Kent? Have you heard anything that they think that might happen, that we could open up sports for young people sooner than later?
Well, presently the OLA is on hold till the 15th, and that is the directive we have received. I mean, obviously, we would like to begin play, and our members would want to play too. But I think the first and foremost thing is the safety of our members and our community. And I don't want us to jump into anything quicker than we should. And I think it's very important that we all pay attention to the people in charge, the medical people, to make sure we do this right, because the last thing we want to do is have a relapse, and possibly, as history tells us, could be worse.
Yeah, second wave is being threatened. Yeah, I guess reading some history about the Spanish flu, and they say the second wave came through was much worse than the first wave. So yeah, we need to pay attention to our public health officials. And what about you, Rick? Same thoughts probably, or you?
Yeah, I echo Kent. I think we have to wait and see what happens. I mean, we won't start up until September at the earliest anyway now. Just, because the rain is, ball hockey and lacrosse and everything else that plays during the summer. So, I mean, if we do get to start up in September, we would still like to run our Day of Champs that was canceled in March. Let the young lads get their trophies and do our Day of Champs for them for the house league. Right. Do our tryouts late August if we can. I'm certainly willing, and I also do the scheduling for Orangeville Minor Hockey, and I certainly want to work with all the other sports groups in town, and we'll figure out how to do that with the help of the town staff to facilitate so that everybody gets to play all the sports.
Yeah, very good. I was thinking about, I grew up in an era where face shields weren't required when I was playing minor hockey as a boy. But the face shields have evolved. You've got the cage style, but you've also got the full plastic. And, now that we're seeing full plastic out there as personal protective equipment, I wonder if there's going to be some mandate on that going forward.
Yeah, at this point, I mean, we haven't really heard much from the Hockey Canada, but I don't know what their plans are. But I mean, that's a great idea.
Well, if it provides the protection necessary, I never liked the plastic myself. I guess I sweated too much. It steamed up on me, and I like wearing the cage more. I thought it was a better vision for myself personally. But if the medical officials require that, there's going to be a pretty nice boost in sales for Bauer or whoever is going to be making those. Mm-hmm. Yeah, I wanted to spin around a bit here because we've put an application into the province for funding to, improve Alder Street Arena. And there are a number of things there that are possible. Both Rick and Joe are resident there quite often. So, one of the things was to add another rink, maybe improve the swimming facility, and probably create a new state-of-the-art library there that, towns of our size have more modern libraries, the design of which are different than the standard library that you'd see at Mill Street. So those are some of the things that are out there. If that happens, then, another ice surface was to be added there, and that would relieve some of the pressure on Tony Rose. What do you guys think about, creating a field house at Tony Rose for, indoor during the winter time, soccer, lacrosse, basketball, that type of thing. You guys supportive of that, Rick? Or what do you think?
Well, I mean, I would support that. Would that be both rinks at Tony Rose?
Again, yet to be determined. I mean, you know, what I'm sensing is that hockey membership is in a slow decline just because of the changing demographic of Canada, right? And so if we have 3.5 rinks at Alder, is that enough for you? That's something you're going to have to determine. But if it does, then Tony Rose could become just a dry facility, and but the idea of having a field house type of, and I don't even know if B rink is satisfactory, because if you do a field house, you're typically a much taller building and bigger, so that you could play football or soccer indoors, because of both of those sports, the ball gets up pretty high. So, but you know, it's just blue skying here. I just think that would be a great spot to do something like that.
Yeah, I know that we did a study with the town, the town did a study, and we were part of it. And I know we're right now sitting at about 3.5 rinks of ice that the town this size needs. And I think with the amount of downtime in Tony Rose B, I think 3.5 pads are suitable at this time.
Right.
So,
okay. So Ken, what do you think about having a field house for the winter so that lacrosse could be either practiced or played during the wintertime? Is that a good idea?
Well, I mean, of course, we would like to play lacrosse all year. And we have the people that would certainly use a facility like that. Right. We have numerous of our members that go down to the various spots south of us that are available to play all year. Right. And there would be nothing better than for them to stay in Orangeville and do something like that. And we would wholeheartedly support something like that.
Awesome. Yeah, we can put an environmental spin on this too, Joe, right?
Absolutely.
We're saving gas money and the environment. So there you go.
So many options there, Sandy, and I not to overshadow what Rick and Kent have talked about, but I really like the concept. And if we're looking at blue sky, and I was also privileged to be a part of that discussion that Rick was talking about on the utilization of the facilities within the town. And I think that, looking at the other organizations that struggle and also primarily not struggle from a membership perspective, but, space and or types of space that they need.